Hi there, FB family and friends. I've made this video to share with you my personal experience and shall not serve as professional advice. Recently, I was diagnosed with inflamed gallbladder with gallstones. And on the 17th of January 2022, I've undergone laparoscopic procedure. So my gallbladder and gallstones been removed. Today I want to discuss with you the symptoms and signs that I've experienced since 2009. In 2019, I was pregnant with my third child, and I felt like there is a sudden punch-like pain in between of my rib here. Yeah, so I was sent to emergency during that time, yet I was not diagnosed with any gallstones or inflammation. So the diagnosis to me that time was only gas pain, because I was relieved after being given with antacid. Yet recently, I've had my first COVID vaccination in November, and 2 weeks after, I started feeling dizzy, sweaty, chill, shortness of breath, dizziness, and nausea. So I rang Healthline during that time, and I was advised to be followed up in emergency care. Then my heart was tested with ECG procedure, yet the result came out negative or okay. And then recently, I started feeling again after my second dose. 2 weeks after my second dose, I started feeling again the same symptoms: sweaty, chill, dizziness, nausea. Although I've heard from some people they've experienced vomiting, but not me. And not until 13th of January, around 10 p.m., I had this terrible pain. I felt like I was punched by Manny Pacquiao in between my rib. So I've asked my oldest daughter to ring 111 for an ambulance. So I was sent to an emergency, and the ambulance crew kept on asking me the levels of my pain. So if 10 is the extreme, then 1 is the not painful, how would I rate my pain? So I said it's not really pain that I felt, but it's like I felt like I was punched here, just one point in my between my rib, in my upper abdomen. So that's what had happened. And then a very young doctor physically examined me. I told him about my signs and symptoms since November 2021, as well as I told him about my history when I was sent to emergency in 2019 when I was pregnant with my third child. So to cut the story short, I was diagnosed with inflamed gallbladder with gallstones, with possible gallstones. To confirm the gallstones, I've undergone ultrasound, X-ray, and X-ray. So that's when the gallstones being confirmed and how big it was. So I was sent to the ward, observation ward. Then I was there for like 3 days being observed, my blood test, daily blood test, daily blood pressure, and everything that is necessary for my scheduled surgery. Every day I am in the list of I am in the list for surgery. Yet every day there's something is wrong until the 5th day. So the 5th day I got up from bed, I feel all right, and I felt peaceful, and I felt like I'm ready for surgery. And so the result of my blood pressure, blood test, and everything was very evident that I'm ready for surgery. So in that very morning, around 9 a.m., I was scheduled for surgery in 10 minutes. I was advised in 10 minutes. So I rushed into the shower and have a little wash. Then after that, I was sent to the surgical theater. The anesthetist, oh my gosh, it's quite hard to pronounce. Well, the one who takes care of my anesthesia, she asked few questions, and yeah, and there was a handover from my daily nurse to the surgical nurse, and that was great. Then here comes my doctor, a surgical doctor. So 2 of them will do the procedure. So he started talking with me about, you know, the procedure, and I've asked him few questions like what will happen to me after the surgery and right after the surgery. So around 10, the surgery has taken place, and the next thing I knew, I was already in a recovery room at 3 p.m. So I was sent to surgical unit at 10 a.m. around 9 a.m. and the surgery started at 10 a.m. Then I woke up 3 p.m. I was already in the post-surgery unit. And I think that's what I think that's it I can share with you. Any questions, please comment down below, and please press subscribe if you want a follow-up for this video, because next thing I'm gonna discuss will be my post-surgical symptoms. Bye, see you next time.